Hi everyone, thank you so much for joining in today. I am Chidamra, founder and mentor at Soul ADC. I hope you're having a lovely Friday today. So, before we go ahead and discuss today, as you all know, today's session is on how to prepare for ADC exam. One thing I want to discuss with you before going ahead is, as you can see the name on the screen, I'm the founder of Soul ADC. And the reason why I have launched this Soul ADC is because I can see there's a huge gap in how you are preparing for the exam and a huge gap in what you should study or not. So I will be discussing all the things today. I want to make it as fruitful as possible for you. So, before we go on to the next slide and we start discussing on everything, my question to you is, what do you think? What is the reason why you are preparing for the ADC exam? What is your goal? Why are you preparing for the ADC exam? Same question. So, anyone who wants to answer that? I would love to hear what your insights are on that. I understand, Dr. Bhavna, that you want to practice as a dentist in Australia, but there should be something that you are looking behind, right? People will say either a growth in the life, financial benefit, or to get a PR or something like that, isn't it? Well, next question for you is, what do you think what ADC is looking after? Why ADC is doing this exam for you? There's always a reason behind everything, right? And if you are able to answer this reason, definitely a lot of things becomes easier for you to understand in the exam. That's why I was asking these questions from you. Now, I understand you know why ADC might be taking this exam every year twice is because they want dentists who can help the community, who can help the patients here. There is not that there is a gap here, that there are no dentists here. Definitely there are dentists, but they are more situated in the metropolitan area. There are gaps in locations, there are not proper dentists everywhere, and that's what should be our target as well. We need to become a dentist who works for the community, who looks behind the community. And when you are thinking in that perspective, that is the reason why I'm giving the exam, you get fruits like financial benefits or getting a PR or any other benefits that you are thinking of. So that's what I want you to think as well, because when you start thinking in that form, your answer starts falling as well, because the main thing is to look at the chief complaint of the patient, and that's how you solve all the questions. So let's understand what ADC people think there's a myth and what is the reality about it. Okay, so when we talk about your ADC exam, what are the myths that people are talking about? People think that ADC exam is an advanced level exam because it's the toughest exam in the world, one of the toughest exam. Okay, so we think that it is very difficult to crack. Actually, you can crack it if you have correct guidance and you're following a correct path. So it is basically an entry level Australian Dental Council exam, which definitely you can crack. One second. Okay, so it is basically an entry level Australian practical exam where basically they are looking at how you work, not in part 1 or part 2. They judge you in both the sections, and that's why they have made the exam pattern in such a way that it is for all the dentists who have graduated and just entered here. So if you are an oral surgeon or a periodontist, you have to think from a dentist perspective rather than thinking as a specialist perspective. And that's very important for us to solve the questions. The second myth that we see is there is usually one obvious correct option that people think about. But if you have option, for example, A, B, C, D, or E in the exam, all the answers will be correct. But it is you who need to identify which is the best answer for that, right? So in the question, there will be some keywords which will help you to identify what should be the right answer. So there are multiple answers. The one who knows everything, the one who can understand, who can critically think, they will be able to solve the question. Now, what is the third myth? Everyone say, let's go and do the past papers. That will surely make you pass. Now, if everyone are doing the past papers, then why not everyone are passing the exam? The passing rate nowadays have been reduced. It has gone to 12% in 2025. What is the reason why the pass rate has reduced? Is the way that you are preparing for the exam. You need to see what all are the things that you need to study, the research papers, the books. I will tell you definitely in today's session. It is going to be fruitful for you, for I'm definitely sure about it. So what we need to know is, not everyone passed the exam. There are only those people who question the answers. Why this answer has been selected and why not that? If you know these things, who can stop you from passing? Okay? So the ADC have a proper blueprint. They have everything, they have categorized and placed it in proper way so that you are able to solve the answers and so that you prepare the exam properly. If you're not preparing it properly, you will be stuck with that. Your past papers, definitely they help you out, but not 100% to crack your exam. There are so many people who are studying in a different way as well, and those people, if they pass, how will you also pass? Because they have a border, they have a method of understanding who are the people who are thinking critically and who can sort it out. For example, in this March exam, they didn't ask you what is the best answer. They asked people what is the least preferable option. Now, if you know the basics, if you know things properly, if you have gone through books, research papers, and all those things, definitely you will be able to answer that. Okay? So, before I go ahead and I discuss, is there any question from anyone? Okay, so I'm going to go ahead and I'm going to show a few things to you. Okay? So, first thing is we need to understand how the questions come up in the exam. They will ask you what is the most appropriate. They might ask you in the question, most likely, most precise, all these words are going to be there. Now, I hope you are aware that there are 280 questions in the exam, out of which 40 are going to be marked, and 40 are not going to be marked, and the rest 240 are the questions where they are going to mark you down. Now, how do they identify those 240 questions based on that you are the appropriate dentist to clear the part 1 exam? Is by looking at who are the people who have maximally answered those questions. Okay, so you need to understand them properly. What is the question? What are the sub questions they are asking for? If you understand the English, these terms, definitely you will be able to even judge or even give a second guess to it. Okay, now what is ADC's framework is, we know it comes under 4 categories, that is 4 clusters that they talk about. First is professionalism, ethics, consent, infection control, and public health. So some people think that it's good way to do it in cluster wise. Let's prepare it in the cluster wise, cluster 1, cluster 2, cluster 3, and cluster 4. And I know that my this cluster is weak, so I'll work on that only. If you think like that, my question to you is, for example, you are studying dental caries. Are you going to separate it down and study it in that way? Like in cluster 1, you will prepare for your what should be the prevention of it, maybe fluoridation. Or cluster 2, then you will think about, okay, what was the case, what should be the investigation I should do to identify where the decay is, the ICDAS codes and all. You have to prepare it in a proper structure. People have different ways of preparing. Either they do it in a cluster way, or they do it with past papers, or they understand things first and then they go on and do past papers and cluster wise understanding. My method is doing it in the third way, because by that there is no stone unturned. Everything is there in front of you. You are prepared properly, and then only you solve your questions and you crack the exam. My method of this is there. I have given the part 1 exam as well. I have given ADC exams, and I cleared the part 1 exam in one go because I followed this method. And if I can pass, you can also pass. Everyone can pass. But your method should be correct. Your understanding should be proper, so that even if bouncer questions are there, you can solve it out. There is definitely going to be bouncers. There are going to be more than 25% this time for bouncers, because now they are not going with the past method of, they also know that you go through past papers and you sit in the exam. They are making things change. They are asking you what is the action behind it, or how does LA work, or what is the least material, what is the best material, what should be the reason for the progression of the condition. If your concepts are not clear, my friend, it will be very difficult for you to clear this exam. And this exam is very expensive. It takes everything from you. I've seen people breaking down because of failing in the exam, of spending a lot of money to prepare for the exam. Okay? It takes a lot of effort, and I don't want you to go through that stress and struggle that people go through. Okay? So I'm going to help you out in understanding what you should prepare, how you should do, so that you clear this exam in one go. It doesn't matter how many attempts you have given. The main thing is you should pass in this attempt. That is what I believe it should be. There are different mentors definitely outside there who is going to help you out. I am not going to say anything about anyone, but my belief is prepare in a way so that your part 1 you clear it, but your part 2 also gets cleared, because your part 2 is based on your part 1. If your concepts are not clear in part 1, no one can help you in clearing the part 2 exam. Okay? So, what do you need to study and how you need to prepare is this slide that talks about it. So, these are all the topics that your Australian Dental Council examination people have given it to us. They have given us what we should prepare, what we should go through, and what we should avoid. Okay? So, these are all what they have mentioned. They have also mentioned us that go through therapeutic guidelines. They have released new therapeutic guidelines now. There is ODEL. There are ADJ, that is Australian American Dental Council, the American journals, the Australian journal, the ADA journals that they have. Then British journals. Then there are others as well, like Journal of Dentistry, which they want you to go through, because there are updates, there are new things that comes every now and then. And if you know all those things, then it becomes easier for us to understand them. Okay? Because things have been changing nowadays. We do not follow any 1997-98 books now. There are more updates, there are new things. I have done research in my past. I've written research papers, so I know how the research should be done. Always remember, go around 15 years, you see 15-year research papers, and then you build up on based on that. If you go beyond that, if you're going in the 1990 something, that's way too old. That is not going to help you out. The concepts have changed. If there is a root canal treatment needed, you should know that which case it should be. Can we do pulpotomy in that case, or it is definitely that root canal treatment be done? There are things changing now, where which material is to be used, what we should do, what we should not do. There are so many new concepts which you need to know. So if you are going through the old pattern, if you're going through old books, you need to change things up. It's not too late, it's just the beginning of the ADC preparation. You have to start working on it. Okay? So you have to build your concepts first thing. You need to look into research articles. My recommendation is from 2010 to 2026. You can definitely go a little bit back, like around 2007, 8, 9. Maximum 20 years period, not before that. Because the things have updated, as I'm saying, don't go to very old content. The answers will definitely change. You need to go through some books as well, what ADC has recommended us. Make short notes as well. For example, in which case are you going to give mepivacaine, in which case you are not going to give your lidocaine, or in varnish, which age group or which type of people should not be given or should be given varnish application. So I'm just giving random examples to you. There are so many things that you need to know. There are different ways of learning. Definitely, some people learn by listening, some people learn by reading content, while others are more into visual by looking at videos and photos and all those things. Whatever works for you, you should look at that format, because you need to pass the exam. If you pass, you are going to be happy. No third person is going to be happy, right? There are past papers, you also follow that, but you cannot rely on past papers at all. There are, just think, 10% of your exam will be cleared by past papers only. So, what about the 90%? Things are changing, you have to change with the things. They are started to change all for part 1 and part 2 as well. In part 2, the teeth are changing, the concepts are changing. So if you are with the old concepts, you need to bug up and you need to correct that as well. Okay? So that is what I want you to do. Now, people who are there in today's session, there is something for you. What I'm going to do is, I want you to message me after that, just DM me. I will send you the new therapeutic guidelines. Now, that is a book that you need to have, you need to study, and you need to have everything on your tips from that. Whether it be the antibiotics to be given, whether it be the treatment plan, or anything you see, that is your book to read. There is infection control guidelines, there are ODEL, there is therapeutic guidelines, there are research papers. There's so many things that you need to go through. Okay, but your TG is the most important thing that you need to go. So when you go back, just message me, just send me, hi, this is my email ID, can you please share the TG? I'll send you this TG, and this is only for those who are in this session today. Okay, so any questions so far? Any doubts? Yes, anyone wants to talk? Okay. So, now I want to tell you what I bring to you. What are the benefits? And it's up to you, but I will tell you that there are different mentors out there. They are there, definitely, they are looking at old content. My content is all new. I look at all the new content. As I said, I have done research. I've written research papers and it has been published as well. So I know how to research, how to study. And I cleared my ADC Part 1 exam in just one go. So I know things. So that's why I want to help the community out. So either you help the community by teaching, or you do it by becoming a dentist. It's basically you need to give to the community, right? And that's what I also want to do for you. I want you to pass your part 1 as well as your part 2. I'm not giving part 2 training, but I'm saying that I want you to pass this exam by yourself, by relying on yourself, by preparing for the exam properly. So I'm going to show you something, and I want you to understand certain things. 1 second. So can anyone see this? Okay, perfect. So this is my videos. What I do is I provide pre-recorded sessions for you so that your concepts are clear. One thing is that once your concepts are clear, then you get your discussion on past papers and mocks. Every module, there are there are 7 modules for you. 8 is the discussion and all the revisions and past papers. So from 1 to 7 modules, we discuss on the subjects, we discuss on the topics, properly understand everything, and then we do mocks. Once we do mocks, we are ready with everything. You are able to get good marks in mocks, and then once we complete all the 7 modules, we go to module 8, and in your module 8 we do all the past papers. We do it in a proper structure. I'm going to show everything out today, so you can definitely click pictures if you like to prepare for yourself. So if you see here,
we are talking about age related and all.
I've just increased the speed.
Molar incisor.
So that's how I explain everything. What is, like you see here, hypoplasia, hypomineralization, how do you differentiate between them, what is important, what is not, so that your concepts are clear. I use pictures, I use videos as well, which are appropriate for the situation. I write everything down so that you don't have to make notes. Your notes are there in front of you. You can see the video repeatedly 4, 5 times, 10 times, as many times as you want. You get all the content. You don't have to go through all the past papers, searching out the answers here and there. No, because not every mentor will give you right answers. I will give you content first, so that if I am wrong, you can prove me wrong by showing my content only, or showing me the research articles that I've uploaded. I am a member of ADA. I have all the resources with me. I have purchased so many resources so that you do not have to go out and look for them. Because it becomes challenging, I don't want you to waste any of your time. In fact, for today as well, I am not going to take a lot of time of yours, so that you can go and start working wherever you are doing or whatever you are doing. Okay? My motto is to help you out as much as possible. So, these are how my videos are going to be. There are so many subjects that I've prepared. If you see, everything is explained in detail. What does something mean and what does something else mean? So that when you go in the exam, you do not fail because of bouncer questions. You pass them. You are the one who is the cream for the exam. Okay? Because not everyone is going to pass. Just remember that. People who prepare properly will be able to pass. Now, this is how I do the past papers discussion. So if you see here,
8 teeth at least involved, and the premolars as well, possibly 4 millimeter. I'll say it's a generalized condition. Okay. Now,
so if you see here, I am explaining everything. I'm breaking down questions, every sort of thing. And not only that, you'll get references as well. If you see here on the top, there's a reference.
it goes.
All the references will be attached with that, so that you are able to understand all those things and you do not stress for the end time. Are you guys so far with me? Yes. So let me show you how the website looks as well. And by the way, we are running a 30% discount till your April
Millions
30th.
of Soul ADC,
After
and I have
April
cleared my
30th,
ADC exam
that
part
will
1 in
be
just 1 month.
discontinued.
I completely get
So,
it
one
what you go
second.
through, all the struggles in beat.
Okay, doctors, I hope you are able to see my screen. Perfect. So, let's look at my course content, how I believe the practice your method should be so that you can clear the exam. So, if you go to the course, we have so many videos, but in proper structure. So if you are studying dental caries, that will be in one area. So if I go to my module 2, I have 7 modules, and the 8th module is past papers discussion, your ADC question banks, and we are going to revise everything with that as well. Now if you go here, I went to module 2. If you see, I have made dental caries session 1, 2, and then new TG as well, dental caries. So all of them at one place. I am not scattering it in 4 5 locations. Okay? If I talk about, for example, I am saying prostho, you can open any video and you can see. So these are how the videos will be. You press it, you view this video, and then definitely you can send me doubt there at that point of time only. So if you're sending me a doubt, just write anything, then a new window will open up. You can attach photo, you can send your voice note here. I will get what your doubt is, and what I give you is that I give you one-on-one mentorship. Why am I giving one-on-one mentorship? Is because all the other mentors who are out there, they are huge, they have 4 500 students, because they have been there for around 10 years. Now if someone is there for around 10 years, how can they help each one of them? 400 students, they'll need 400 mentors, isn't it? I am a mentor who has worked from the basic, from the scratch. I have made from the bottom so that you can clear this exam, because I can see that gap. Not every mentor is explaining properly. Their answers are changing every now and then. They are giving you old content. I will not mention anyone's name because I am also a mentor. I cannot degrade anyone. Everyone are doing their part. They are all good outside. But I will just say their method is different than mine. My method is to upskill you, to grow, to bring the growth in you so that you are able to clear the exam. You are able to solve the questions by yourself as well, even when the questions are what not been discussed before by anyone. Okay, so I will explain you all the things in the modules. Then we go on with the past papers discussion. So if everything has been left behind, that will be covered in that. And anytime you feel that this concept is not clear, just write it down to me. I am available on WhatsApp. I'm available through this chat. We have 2 mentors together. Who have given ADC exam, cleared the part 1 exam easily. So we will be helping you out, even if we have to make a new video for you or new presentation or get you pictures or do anything, we will make that concept clear for you by anyhow. Because as I said, you will pass, then only I will pass. I pass only when my candidates will pass. That's what I believe. And to be honest, for any mentor, if we talk about, 100% will never pass. I'm not talking about myself or anyone out there. I'm just saying not everyone pass, because everyone have a different way of understanding. And that's why I have included and made a try model of learning, that is reading, listening, and understanding things by looking at different parameters, different things, so that it is grasped in your mind, it stays in your mind, and you can remember things easily. Okay, so that's how the doubt part goes in this part. Then we have documents. Now we have documents here. There are so many documents. I am still looking out at other documents, and I am right now adding more documents here, and that will be completed by April 30th. And once you join, you will see huge amount of documents, because I'm just looking at what references I used, and I'm adding more content from ADA website. As I said, I am a member of them, so I have all the access to everything. I am going through all the recent researches, and I'm uploading it here so that you are not behind. Yes, with respect to your time period, one second. Where's the message gone? Can I ask you about the time period? See, see, Dr. Bhavna, you have to start as soon as you can. It's not that you cannot prepare it if you start late. Definitely you can, but as I have already discussed, 12% is very less. 12% passing rate for ADC. If 3,000 people sat for the exam, around 400 cleared the exam. You have to be in that above level. So if you start preparing now, you are confident enough and you will be able to crack the exam. Now, what my suggestions is, if I show you my, if I go back to the presentation, the website, what I suggest is you go one by one. You take 1.5 week or maximum 2 weeks to do one module. When you complete all the 7 modules, you go back and revise. The best thing is to revise. You don't have to memorize anything, right? You don't memorize things, you understand things. And that's how you clear the exam. So that is what my end note is. I want you to prepare, start preparing from now, so that if anything happens, you can cover it up. You can cover if you are missing in between, you are sick or something. Mostly people say take around 8 to 10 hours to 12 hours to prepare for the exam. My suggestion is, if you go in a proper structure, the way that I tell you, you can clear the exam by preparing 4 to 5 hours in a day. That's all that you need. Okay, the concept should be correct, your method of preparing should be correct, so that you do not go haywire and then you miss things out. Okay, so any questions before I end the session today? Okay, so what you guys can do is, whoever is interested in getting the new therapeutic guidelines, please DM me. I will send you the guidelines on the email so that you can prepare it, you can start working on it. Definitely it is going to be confusing for you if you're giving it or you're reading it for the first time. You repeatedly read it, you get the things in your mind. Then I read the previous therapeutic guidelines around 10 times maybe, and every time I used to get new concept. So you don't have to break in between, you have to read that therapeutic guidelines. And if you go through Soul ADC, you will get recorded sessions for therapeutic guidelines as well, where it is not in just reading format, it is going to be in a proper way. You will be explained why this is the reason, why not this is the reason. When your concepts are clear, you will clear this exam. No one can stop you from that. Okay, so let's end up today's session. Yes, I can share my number. Let me write it down on the group. 1 second. It's actually here on the on my presentation as well. Yeah. So that's my contact number. This is my website from which you came and joined this live session. That's our WhatsApp community group. If you're not part of it, please join, because whenever I'll do free sessions, if you are part of Soul ADC or not, you will definitely get those sessions as well. You should take as much benefit as you can. And in fact, we are also there on YouTube. We have done few sessions before. That was on caries, that was on the ICDAS and your temporomandibular joint. I will highly recommend to go through temporomandibular joint disorders from the YouTube, because that will clear your concepts. Okay, you should know things, and if you go through it, I am sure you'll know how I teach it in a proper way, make things easier for you, so that you don't have to memorize things. Okay, so my number is 0411 671 599. Any other questions? Anyone has any other questions? Okay, so I'll just end today's session. I hope you guys have a lovely day. And if you have any doubts, definitely you can chat with me. You can do a free one on one session with me. I can help you out and how you can start and all those things. I just really want to help you out to clear the exam. It's never too late to start the preparation for the exam. And trust me, if you are going in a right path, you will clear the exam. It is not that, I know it's the toughest exam in the world as when we talk about a dental exam, but it is not doable. It is doable and you will be able to do it. Okay? So I hope you have a lovely day. Thank you so much everyone for joining in. Okay, Dr. Shrishti, it's okay if you have not received your degree, but basically, what ADC want is they want that you have completed your 4 years of graduation, and people apply during their internship period. So you need only your transcripts that you can send to your ADC. So you have to go to ADC Connect and upload your transcripts that will be provided by your university. You can give it to them and you can start preparing for that. Okay. You have done it all. If you want, if you need any guidance on that, you can contact me. You can message